Can you see my slide?
Yes, we can see the slide. Perfect.
Okay, thank you. Thank you, Dr. Rao and Dr. Sharma. Moderators. Good evening, everybody. Uh, it is my great pleasure to have an opportunity to talk here at this web symposium. First, I would like to thank Dr. Rao and Dr. Sharma and Santen India for their kind invitation. Today, I will talk about dry eye diagnosis from the lens of the Asia Dry Eye Society, while introducing TEPOT tear film-oriented diagnosis for dry eye based on fluorescent dynamics. I will also introduce decreased wettability dry eye, the new important concept in tear film-oriented diagnosis. Based on TEPOT, 30 seconds are enough to suggest the insufficient component for the ocular surface and to classify the dry eye subtype for dry eye. This slide shows my disclosure of COI. This slide illustrates the difference of corneal surface between normal eye and cases of dry eye. As seen in those movies, in normal eyes, the tear film is stable and is not easily broken up, even when the eye is kept open. In contrast, in cases of dry eye, the tear film is unstable and easily breaks up with resultant epithelial damage. The visible abnormality of unstable tear film reflecting in the fluorescent breakup and epithelial damage is helpful and essential to the diagnosis of dry eye. Ideas about the mechanisms of the vicious cycle of dry eye vary between Japan and the United States and elsewhere. In Japan, we pay more attention to unstable tear film when considering the vicious cycle. From this aspect, any tear abnormalities or decreased wettability of epithelium will cause unstable tear film, which result in epithelial damage. And the resultant epithelial damage will cause unstable tear film via the decreased wettability of the epithelium, thus resulting in the vicious cycle. In the United States and elsewhere, hyperosmolarity and inflammation, resultant inflammation are thought to be included in the vicious cycle, and more attention is paid to the inflammation. Those differing ideas often influence the emphasized findings in the diagnosis and therapy for dry eye. In Japan, we emphasize the visual abnormalities, including breakup time BUT and superficial punctate keratopathy or SPK. In contrast, in the United States and elsewhere, invisible abnormalities, including hyperosmolarity and inflammation, respectively, are emphasized in relation to diagnosis and therapy. We Japanese dry eye specialists do not deny the importance of inflammation, but in general, we regard inflammation as the result of the vicious cycle and not the cause of the vicious cycle. This slide shows the definition of dry eye from TEPOT 2. According to this definition, dry eye is characterized by a loss of homeostasis of the tear film, in which not only tear film instability, but also hyperosmolarity, inflammation, and damage and neurosensory abnormalities are important etiologically. On the contrary, the Asia Dry Eye Society held a diagnostic definition and dry eye collaborative investigation meeting in 2014. We proposed here our definition of dry eye from the Asia Dry Eye Society to define more precisely the dry eye cases that we encounter clinically. In this definition, dry eye is defined as a multifactorial disease characterized by unstable tear film, causing a variety of symptoms potentially accompanied by ocular surface damage. We emphasize here the importance of unstable tear film as a visible core manifestation of dry eye. The reason why unstable tear film is so important, there is a short BUT type dry eye, which is sometimes overlooked but needs treatment. The representative cases of short BUT type dry eye shown in those movies. you can see minimal or no involvement of corneal epithelial damage in spite of very shorter breakup time. An original and insightful report about this dry eye subtype was reported by Professor Tsubota's group, where short BUT type dry eye was introduced as dry eye seen in younger age patients with severe symptoms such as dryness and eye fatigue, with abnormal BUT yet no abnormality in CMR1 test and clearance test, and with association with allergic conjunctivitis. Recently, there are increasing number of studies on short BUT type dry eye, in which an association with visual disturbance, the effective treatment by eye drops or punctal plugs, and the relation to decreased mucins have been reported. Together with our definition of dry eye, we proposed our diagnosis of dry eye from the Asia Dry Eye Society to more appropriately diagnose the dry eye cases that we encounter clinically. In the diagnosis, we emphasized again the importance of unstable tear film as a visible core manifestation of dry eye. Based on this definition, we have established the diagnostic criteria for dry eye in Japan in 2016. In this 2016 criteria, the definition became very simple and it involves only the positive symptoms that are related to ocular discomfort and or visual disturbance, and an abnormal BUT of less than or equal to 5 seconds. In this diagnostic criteria, the short BU type dry eye is diagnosed as definite dry eye and should be treated. However, it is important to note that abnormal BUT tells nothing about dry eye subtype, thus resulting in an inability to consider the most effective treatment for each dry eye case. Please watch this movie. Associated with this, can you tell what is the insufficient component associated with this dry eye? What types of dry eye? The answer is provided TEPOT by TEPOT tear film oriented diagnosis. In order to discover any insufficient components of the ocular surface responsible for tear film breakup and classify the specific dry eye subtype, it is quite useful to observe the dynamic behavior of fluorescent and fluorescent breakup patterns. One of the most important properties of tear film is stability. The four components that support tear film stability are the tear film lipid layer that is thought to suppress evaporation of aqueous tears from the aqueous layer, aqueous tears of the tear film, in which sufficient aqueous tear volume is important for supporting tear film stability. Secretary mucin, Mach5AC of tear film, which gives gel character to the aqueous layer, and the membrane-associated mucins, especially the longest Mach16, which retain wettability of the corneal surface epithelium. With abnormalities 1, 2, 3, and or 4, the tear film becomes unstable, that resulting in tear film breakup that leads to epithelial damage. TEPOT, tear film oriented diagnosis, to find the components responsible for tear film breakup from 1 to 4 has advanced in Japan. Tear film oriented diagnosis, or TEPOT, is a new world direction originating from Japan. TEPOT is a diagnostic method to suggest the insufficient component of the ocular surface responsible for tear film breakup and the specific dry eye subtype. For TEPOT, observation of tear film dynamics and the classification of the tear film breakup pattern are essential. For example, this breakup pattern is a line break, which suggests that the insufficient component is aqueous tears, and the specific dry eye subtype is an aqueous tear deficient dry eye. Therefore, the point of emphasis for evaluating dry eye in Japan has shifted from epithelial damage, BUT, to TEPOT via breakup patterns. This scheme produced by the Dry Eye Society of Japan shows the detailed concept of tear film-oriented therapy, TEPOT, illustrating the target for therapy and the possible candidates for topical therapy currently available in Japan and elsewhere to improve tear film stability. In this concept, detection of the insufficient components of the ocular surface responsible for tear film breakup is the first step, which is followed by the supplementation of insufficient components to attenuate dry eye symptoms via the prevention of tear film breakup. However, for the detection of the insufficient components of the ocular surface responsible for tear film breakup, TEPOT, tear film-oriented diagnosis is essential. And for TEPOT, classification of breakup patterns is the most effective and useful. Here, I'd like to introduce the fundamental knowledge about the wettability of the surface. Please have a look at this photo and note the water droplet on the petals. When the petals are tilted, it is expected that the water droplet will easily fall off. So like petals, stability of the aqueous fluid is not only determined by the specific fluid components, but also by the wettability of the surface. It is well known that the condition of the contact of aqueous fluid to the surface is determined by the wettability of the surface. In other words, wettability, and that when the wettability, in other words, hydrophilicity and water holding property of the surface is better, the aqueous fluid is more stable. In regard to water repellency of the surface, this relationship is reversed. On the surface of the cornea, wettability is thought to be maintained by the intactness of Mach 16, the longest of the membrane-associated mucins. Please watch this movie. This is an example of decreased wettability dry eye, in which you can see a spot break at the upper part of the cornea immediately after eye opening, and random break with rapid expansion at the inferior part of the cornea. At the lower part of the cornea, after the tear film established on the cornea, which is confirmed by the stoppage of upward movement of fluorescence, once random break happens in the inferior cornea, it expands very rapidly due to the decreased wettability of the corneal surface. Spot and random break with rapid expansion both correspond to the breakup patterns seen in decreased wettability dry eye. We should pay more attention to decreased wettability dry eye, which can be diagnosed through TEPOT based on breakup patterns. This slide shows the dynamic behavior of each tear film layer until the establishment of the tear film theoretically. This is the cross section, this is the upper lid, and this is lower lid. During eye opening, capillary suction pressure from the upper tear meniscus pulls the aqueous tears up, resulting in the deposition of aqueous tears on the cornea. However, insufficient suction to pull the lipid layer up results in the surface pressure gradient on the lipid layer immediately after eye opening. This gradient, in turn, results in an upward split of the lipid layer, which simultaneously drags aqueous tears up. However, simultaneously with the aqueous drag, there is an aqueous thinning by the capillary suction pressure of the lower tear meniscus. In those movies obtained from the same eye, tear film lipid layer behavior, together with fluorescent-stained aqueous movement can be seen. After the cessation of the upward split of the tear film lipid layer or upward movement of the aqueous tear film, precorneal tear film is established. Related to this tear film establishment, 5 different essential tear film breakup patterns can be classified. The first is the area break. When the ACAS tear's volume is extremely diminished, you can't see any upward movement of fluorescence after eye is opened. The second is the spot break, when the wettability of corneal surface is impaired. You can see the spot break immediately after eye opening. The third is the line break, resulting from the simultaneous action as explained. Aqueous drag and suction from the lower tear meniscus, which result in the line-like breakup during the upward movement of fluorescence. The fourth is the dimple break, which is speculated to be related to the decreased wettability of the corneal surface. You can see the dimple break during the upward movement of fluorescence at the thicker part of ACAS layer. It is quite in contrast with the line break. The fifth is the random break, which thought to be related to increased evaporation. After the stoppage of fluorescent movement, upward movement of fluorescence, after the establishment of complete tear film, you can see the breakup. This is the evaporative mechanism. This is the summary of the classification of fluorescent breakup patterns. Fluorescent breakup patterns can be classified into 5 patterns, which include area, spot, line, dimple, and random breaks. These are essential breakup patterns that occur in dry eye based on different mechanisms. In addition, rapid expansion of the breakup joined in this essential breakup patterns, and here you can see a case of line break with rapid expansion. Based on the breakup patterns, we can suggest insufficient components of the ocular surface. For area break, ACAS fluid is insufficient. For line break, ACAS fluid, spot break, dimple break, rapid expansion, Mach 16 is insufficient. And random break lipids or Mach 5 acid, which can suppress the water evaporation, is impaired. Also, based on the breakup patterns, we can suggest the specific dry eye subtypes. Area break corresponds to severe ACAS tear deficient dry eye. Line break corresponds to mild to moderate ACAS tear deficient dry eye. Random break corresponds to increased evaporation dry eye, and the spot, dimple, and rapid expansion of the breakup are thought to correspond to decreased wettability dry eye. Here, I would like to introduce a very important steps of how to effectively perform TEPOT via fluorescent breakup patterns. First, in order to not to increase tear volume, a less invasive way for staining tears is essential. Installation of 2 drops of saline and artificial tears followed by vigorous shaking of the stained strip and just touching the central top of the strip to the lower lid margin. I showed you here 3 times, but once is enough to stain the ACAS tears by fluorescence. Second, after several blinks, the patient is verbally instructed to briskly opening the eye and keep the eye open after gently close the eye 3 times to confirm the reproducibility of the breakup pattern. Gentle close, rapid eye opening is important. You can't see any breakup patterns during the natural blinking. And you can confirm the rapid expansion of break. This is a line break with rapid expansion. Please note, a reproduced breakup pattern must be more related to the pathophysiology. The first case is corresponds to the spot break, and the second case corresponds to the line break with rapid expansion. Via TEPOT, both correspond to decreased wettability dry eye. This slide shows the classification of dry eye disease proposed by TEPOT due to. Please note that for the classification of dry eye, TEPOT due to proposed only 2 dry eye types, subtypes, including ACAS deficient and evaporative. Also, there is a mixed type of those. On the contrary, this slide shows a new dry eye disease classification proposed by the Asia Dry Eye Society, in which decreased wettability dry eye is included as an important and neglectable dry eye subtype. As another breakup pattern for decreased wettability dry eye, we recently added the breakup pattern with rapid expansion. And the corresponding main breakup patterns for each dry eye subtype are indicated here. In summary, the most important property of tear film is its stability, and the fluorescent breakup can be a visible core manifestation of dry eye. TEPOT, tear film-oriented diagnosis, is a new concept for dry eye diagnosis based on the observation of the tear film dynamics and the breakup patterns using fluorescence. This can provide information about the insufficient component of the ocular surface to make tear film stable. And that's a dry eye subtype. From the point of TEPOT for dry eye, not only the detection of spot and or dimple breaks, but also the detection of rapid expansion of breakup must be essential for a proper diagnosis of decreased wettability of corneal surface and or decreased wettability dry eye. Recently, I published a book entitled TEPOT and TEPOT Expert Lecture Paradigm Shift in the Clinical Practice for Dry Eye. An English version of this book is also available. You can enjoy TEPOT and TEPOT quizzes on your mobile device. I hope that you will be able to master TEPOT and TEPOT through reading this book. Thank you very much for your kind attention.
Thank you so